All right. Good afternoon, everybody. It is 4 o'clock on Monday. I hope everybody is doing well after a rare Sunday Halloween. So normally 4 o'clock on Monday is entirely about COVID. We've been doing that since the Delta variant hit. Today we're going to mix it up a little bit because for the first time since the Delta variant hit, all the good news of a week is so much that we need to split it up a little bit before we get to Thursday. And that is a good challenge for us to have. So today we're going to start with some good news on economic development. We're then going to talk about Connect, which opened today. And then we're going to go into the COVID report. The primary theme coming out of that is you really need to get your booster, because we are seeing hospitalization among vaccinated people going up month after month after month, which suggests waning immunity. So getting your booster is incredibly important. In fact, I believe I'm going to get mine live on Thursday when we do the Team Kentucky update. So today, let's start with good news. Kentucky is experiencing unprecedented economic momentum. And today we've announced that this year's private sector new location and expansion projects have exceeded $10 billion in new investments for the first time in the Commonwealth's history. And they've announced more than 15,200 full-time jobs. This is not just breaking a past record, which we did more than a month and a half ago. This is adding a zero to anything we have ever seen in the history of the Commonwealth. It is a monumental achievement for our state, which represents months of dedication from local and state economic development leaders and businesses across Kentucky. It means that today, more than any day in our lifetimes, maybe even in our history, Kentucky is trusted by businesses all over the world to truly deliver. That when they have their big project, when they need to get to market, when they are making an enormous investment, who do they trust? They trust us more so than anybody else. This has been an incredible year for economic growth, but we are just getting started. Through the first 10 months of 2021, economic momentum in Kentucky has exceeded any other full year total for investment growth. Year to date, more than 110 private sector new location and expansion announcements include nearly $10.3 billion in total planned investment, while creating, again, we talked about more than 15,235 full-time direct jobs. Additionally, jobs announced through September include an average incentivized hourly wage of $24.15 before benefits, a 10% increase over 2020, which was the second highest full-year average in the past 6 years. So what does that mean? It means we have our best year by total investment by far. It means we have some of the highest new job totals we have ever seen at the second highest wage that has ever been announced in Kentucky. This is good for our state. It's good for our future. It is really good for our families. The automotive industry has been the top sector for investment and job creation thus far this year. That's not surprising, right? Given that the Ford SK was a $5.8 billion investment, the largest in our history. But total automotive is now up to $6.6 billion and more than 7,100 full-time jobs, solidifying an industry that already employs over 100,000 Kentucky residents and more than 525 suppliers and 4 assembly plants. Other top investment sectors. So automotive is the top this year. Food, beverage, and agritech, there's $1 billion of new investment in it. Metals, $965 million. We're going to work to get that over $1 billion before the end of the year. I think it will. Business and financial services, $558 million. That's really exciting. Plastics and rubber, $240 million. And logistics and distribution, $157 million. Rounding out the top 6 sectors for job creations. Our business and financial services, about 2,500 new jobs. Metals, close to 1,700 new jobs. Food, beverage, and agritech, almost 1,100 new jobs. Logistics and distribution, 828 new jobs. And healthcare, 824. Companies have invested not only record amounts, but they have invested, and so let me back up again. Companies have not only invested record amounts and are going to create jobs with near record pay, but they have invested all across Kentucky. We talk about this being a historic moment where everybody needs to be included, and we need to make sure that prosperity reaches every part of the state, and it is. Along with Toyota's investment last week in the Bluegrass region, $470 million, I think, going into that facility, almost 1,000 new full-time jobs. We've had App Harvest with $42.5 million investment in Berea. And Community Wellness Technology, a $3 million investment, creating 445 jobs in Danville. The Cumberlands region, these are ad districts, saw Firestone Industrial Products announce and break ground on a 250-job, $50 million plus expansion in Whitley County. Chapin International, which also announced a new facility in Boyle County, added an $8 million investment in Mount Vernon, pushing their total commitment to almost $14 million and doubling job creation to 200 positions at that facility. In Eastern Kentucky's EKCEP region, Lion First Responder PPE is going to reopen its Beattyville manufacturing facility after more than a decade. That is a pretty cool story in the same facility. It's going to create 75 jobs. WellCare of Kentucky's doubling its staff in Hazard with 18 new jobs in an expansion project that saw the community selected over locations in Nashville, Tennessee, San Antonio, and Tempe, Arizona. In the Green River region, Pratt Paper announced the largest investment in Western Kentucky in more than 25 years, $400 million paper mill, creating 321 great paying jobs in the Henderson area over the next 5 years. Last week in the Kentuckiana Works Greater Louisville area, GE Appliances roaring back. Those of us who watched those job losses over the years, that hurt. Seeing American manufacturing back and GE leading the way has been pretty special. They announced a new $450 million investment, creating over 1,000 additional jobs. KCC Manufacturing announced and broke ground on a 700-job, $60 million facility in Simpsonville. And Velan North America announced a new headquarters in Louisville and a new recycling facility in Shelby County, 150 jobs, over $100 million. In addition to Ford and SK Innovations investment in the Lincoln Trail region, that's kind of the greater Hardin County region, Canadian-based Kruger Packaging. We were really excited about this one. I remember making the calls myself. $114 million commitment, 150 additional jobs in Hardin County to establish its first corrugated box plant in the United States. We were first. Northern Kentucky's announcements, the region is like the rest of Kentucky on fire. Nucor's $164 million, 72 job tube mill in Gallatin County, and Fidelity Investment adding 600 professional positions in Covington, and so much more. Dollar General, hundreds of additional employees. South Central Kentucky, more investment in about a 4-month period than I think we've seen in several decades. Tyson Foods, 451 job Bowling Green facility announced last week, $355 million investment there. Fruhoff Inc. planning to reestablish a U.S. presence, $12 million investment in Bowling Green. In the Tenco region, 4 companies are expected to create with over $20 million in new investment. From Alstrom Monksjoe to build a second facility. Jobs there. Metalsa Structural Products, Hopkinsville. Year-to-date economic success, recognitions for us throughout the year. It's our goal. It is our goal to keep this train going. We have another new jobs announcement. Wheel of America celebrated the grand opening of Pro Ace plant in Bourbon County. The WA's Bourbon County operation and includes plans to create 145 jobs for Kentuckians in this central Kentucky region. Lieutenant Governor Coleman was there to celebrate that day. This company is a maker of aluminum and steel wheels for passenger cars and light trucks. As we've seen over the last several weeks with major announcements from Ford, SK Innovation, Toyota, Kentucky has cemented its leadership role in the automotive sector, and we're excited about innovators that are out here making sure they're going to compete for the electric vehicles of the future. This new plant represents a 40-acre expansion of its existing campus and will allow the company to boost its production capacity by a full 50% because they have surging demand. Before the expansion, they could produce 2 million aluminum and 6 million steel wheels annually. Company says with the added capacity, they're going to be able to increase production by an additional 1 million wheels a year. This new plant, again, 40 new acres, 145 new jobs, and this company's workforce in Kentucky is now at 700. That is greatly appreciated. That is 700 Kentucky families working for a great company in this region. We want to thank them for their leadership, for believing in us, for picking Paris and Bourbon County. So very exciting. All right, one more piece of great news that broke originally on Saturday, but means hundreds of millions of dollars won't be exiting Kentucky or lost by some great Kentucky businesses. So yesterday, the Biden administration announced a deal with the European Union to remove costly and burdensome tariffs on one of Kentucky's flagship and one of its most delicious industries, bourbon. Working together with U.S. Secretary of Commerce and a friend of mine, Gina Raimondo, U.S. Trade Representative Catherine Tai, and members of Kentucky's congressional delegation, including Congressman Yarmouth, our administration has taken an active role. These things were retaliatory. They were hitting bourbon harder than anywhere else because we can't move production offshore like other companies were going to be able to do with other products. This is an $8.6 billion industry for us, 20,000 Kentucky jobs. Now, earlier, they had pushed off when the tariff was going to significantly increase, and we thought that was a win. But the deal yesterday is going to prevent a catastrophic 50% tariff from going into effect, and all the tariffs, we believe, are going to be gone by January 1st, 2022. So I want to thank everybody in D.C. who worked hard for us. And I was just up there, last week or the week before, and all the while, Secretary Raimondo and others giving me the personal assurance that they cared about Kentucky, that this was the number one thing on their agenda, these tariffs. You know what? They did an incredible job because of that work, because of the work of so many. This industry is going to continue to thrive. I remember I was calling Secretary Raimondo, wondering why she wasn't picking up. It was her confirmation hearing in one of the first calls I made, but kept going because this is way too important for Kentucky. And everybody, including in the EU, deserves Kentucky bourbon. All right, let's move to Connect, and then we'll get to COVID. Enrollment is now open for individual health coverage through Connect. It is important. This is now, as of today, your opportunity to sign up for plan coverage that begins in 2022. There's a convenient place where you can go to see everything available to you, and you need to shop around. It's the relaunched Connect portal, connect.ky.gov. Healthcare is a basic human right. And with the relaunch of Connect, more plans are going to be available to Kentuckians that were on the federal exchange. And as Secretary Friedlander will tell you here in a minute, with just a little bit of searching on the site, you should be able to get cost savings from last year. Many of us haven't seen cost savings or reduction far too long. Enrollments submitted through December 15th, 2021 will qualify for coverage that starts January 1, 2022. Coverage will start February 1, 2022 for enrollments submitted December 16th through January 15th, the last open day of open enrollment. So if you want your coverage to start at the beginning of the year, you need to sign up by December the 15th. This is our state-based marketplace. It's going to save us $15 million a year that we're going to try to give back to that consumer. But Connect is now bigger than that. Connect is an opportunity to get a little bit of help, to get back on your feet, or if you're struggling to get by, to give you just a little extra security as you work to ultimately move forward. You can get benefit and resource information on child care, on elder care, on food benefits, on utility assistance, transportation, job training, and veterans benefits, all on the one site, connect.ky.gov. And 2 new health insurers are going to be offering coverage in 2022 on our state-based exchange. Ambetter from WellCare and Passport Health Plan by Molina. Plans are also available from Anthem and CareSource. These are the most options on a government exchange that our people will have had in a number of years. Portal visitors can also access information about a vision plan that's going to be offered, I think, for the very first time. Kentuckians currently enrolled in Medicaid can switch their managed care organization in this portal as well, but they got to do it before December 1st. Kentuckians who are eligible for Medicare or prescription drug benefits can enroll on the Medicare.gov website. So you can, again, access online. If you don't have access to a computer, you can call. So please, everybody, let's get signed up, and you can get assistance from connectors and licensed health insurance agents. There are so many ways to get signed up, to save a little bit of money. Make sure that you shop around because there are more choices to look at than ever before. Secretary Friedlander.
Thank you, Governor. Could we have the map up again, please? So the previous year, we had about 26 counties that only had one choice. This year, we're down to 14. There's more choice across Kentucky for plans all across the state. And I just want to reiterate what the governor said. This is a good one. This is the previous year. You can see a lot in Western Kentucky that only had the one plan. Now, if you go to the next slide, you can see the difference. It's an incredible difference that we have added so many plans. And as the governor said, you need to shop around. So I know I'm quoting either Smokey Robinson or Captain Tennille, but we need to follow their advice. The important thing to do is to look and plan and take time, talk to the connector, talk to the agent, and have them help shop around. These plans, you are likely to find one, hopefully that is less than what you are currently paying, but you have to look around. And here are just a couple of tips. Make sure if there's a hospital you would like, that hospital's in the plan. Make sure that if there's a doctor you would like to use, make sure they're in the plan. If you have prescriptions that are maybe a little out of the ordinary, make sure that those are covered. There are connectors out there to help you. There are agents out there to help you. And this is good for Kentucky. Connect can help people get to resources. As the governor said, Connect Resources can help you get to benefits like childcare. And now, finally, a state-based exchange for Kentucky. We control the exchange. We control the plans. We can invite people in. And that's exactly what's happened. And we'll continue to do that. So this plan will be built, Connect will continue to be built, and we'll make it better every day for Kentuckians. Thank you, Governor.
So pretty exciting to go from 2 choices to, in some places, 4 choices, many places 3, like almost all of Eastern Kentucky. Still just have a few counties with 1 option. We got to work on that, and we will. But this is a lot of improvement in just a year. All right. So we talked about the economy. We have talked about Connect and staying healthy. We know how important that is every day, not just in a pandemic. Let's do our COVID update. Generally, good news today. Few small things that we're going to need to watch over the 3 days we're going to report on today. 48 deaths combined. That's losing far too many Kentuckians, but for a 3-day period, lower than what we have been seeing. So on Saturday, we had 941 new cases and 10 new deaths, but they included a 34-year-old woman from Madison County. On Sunday, 711 new cases, 12 new deaths, and they included 3 people, pretty young, a 35-year-old woman from Anderson County, a 40-year-old man from Anderson County, and a 42-year-old man from Breckinridge County. So remember, the Delta variant is killing younger and younger people, 30s and 40s. We need a much higher vaccination rate. Then on today, 568 new cases, 26 new deaths, including a 41-year-old woman from Adair, a 24-year-old man from Bullock County, 35-year-old woman from Jefferson County, and a 45-year-old woman from Nelson County. All of our hospitalization, ICU, and ventilator numbers are down over the last 3 or so days. 772 Kentuckians currently hospitalized because of COVID, 249 in the ICU, 138 on a ventilator. Positivity rate now down to 5.03%. But I'm going to talk in a minute just about a couple of things we need to watch. We don't put a whole lot of stock in day over day positivity changes as opposed to week over week, but I will say today is higher than yesterday. And that is the first time in over a month that we haven't seen a drop every single day. Let's look at our stair-stepper chart, which gives us a good idea of where we are going. We now have 6 straight weeks of declining cases. Let's see, yeah, because we had the blip there, 1, 2, 3. Now down to last week, 8,603 new cases. I really like this chart. We need to really look at next week because the week over week decline was smaller from this last week and the week before than we have seen since the decline actually began. And I will tell you that today's numbers of cases are actually higher than last week. In other words, this Monday is higher than last Monday. And that's the first time we've seen that in a while. That could be a whole lot of things. And it's too early to say that we will plateau or any of the rest. It's just something that we need to watch. And there was another time, if you look kind of up here, where we may have been thinking the same things. So this is just trying to give you an idea of what I'm looking at, that we can also watch the rest of the week. Positivity rate, now 7 straight weeks of decline. Again, getting to almost flat, 5%. We'd like to see that continue to decrease. 5%, still a lot higher than we would really like out there. But this decline is a little bit better when we look at the rate of decline than the actual case chart. Of course, the best charts are when we show that we have fewer people that are really sick from COVID. So let's look at the hospital. Again, we have a nice downward curve here. It may be starting to flatten out a little bit, but there is definitely a declining slope that is still significant. We'll watch this in the next couple of days. The downward slope on the ICU, maybe even a little bit better. Obviously, we want this one really, really low because when you're in an intensive care unit, you are really sick. Ventilator chart, same way. It is, we've been saying positively negative. It is declining significantly, and that is again what we like to see. So all of the trends that we would measure week to week when we'd really look at them are good. But again, the 3 things that I'm just watching and we need to watch and to be humble about where this can go is the drop week over week from this last week and the week before is one of the smallest that we have seen. So we hope that doesn't mean that our decline is slowing, but we have to watch that. Sunday's positivity rate was 4.98%. Today's is 5.03%. Statistically, with a couple more days, that could even out, or it could ultimately not be necessarily meaningful. But as I look down this chart, That's the only time, at least in the past 4 weeks, that it hasn't just, with the exception of one, that it hasn't gone down just about every day. And then finally, today, 500 and plus 568 reported cases, more than last Monday at 544. So we will watch all of those, but again, our trends are going in the right direction. We just want to continue to beat COVID and to see it spread less here in the Commonwealth. Other trends pretty good as well. We have the most ICU beds available that I remember in a while, 203. That number hadn't been above 200 very often. Hospitalizations over the last 7 days decreased 10%. 8 kids in the hospital with COVID, 5 in the ICU, 4 on a ventilator, and we're now down to 54 of our 96 hospitals reporting critical staffing shortages. So let's talk about hospitalization and who is being hospitalized a little bit more, because we're going to show you some data that has really come in a big clump really over the past 4 or 5 days that shows how important getting a booster is. So we have thought for a while, when we look at those that are vaccinated that end up in the hospital or even end up dying, they are folks that may be predisposed. But we also think that waning immunity is a real factor. We can look at every month since the largest portion of our vaccinations, and we can see an increase in the percentage of overall cases that vaccinated people make up. In other words, more vaccinated individuals are getting COVID or being hospitalized by COVID. Every month we go further from that original date of vaccination, or when most of our population was vaccinated. So I want to show you this in cases. This is a line graph. This is the best we could do to try to put it together. As you can see in March, obviously the Delta variant hadn't really hit at that point, and that's the low point, right? That is when we are just getting everybody vaccinated. And as you can see, it's fairly small through May. These are fully vaccinated individuals. As of May, only 5% fully vaccinated, only 5% of all cases were fully vaccinated individuals. But come all the way through October, and we're now between 20 and 25% of all cases. I can show you that specific number in a second. I think when you look at this growth, the only natural explanation is that the immunity does lessen a little bit over time. The Delta variant is part of it, right? But this means you need to get your booster. And from all the data we're seeing, we think we can turn this line back around and get it down to where it was in March, that even with the Delta variant, the boosters will give you the level of immunity that we probably had in March and April and in May, when it was 5% or under. But if you think about how protected you were then, and you were not that well protected now. We'll show that in a couple different ways, but you will be that well protected with the booster. Now let's look at hospitalizations. And this is maybe even a little more, an even better example of how over time the number of people getting sick and really sick from COVID that are fully vaccinated has increased. Again, it's in part because of the Delta variant, no question. But you also see over time, though we did increase for a little while in our vaccines after we'd kind of plateaued, which I think explains a little bit of the downward curve. What we are seeing is a need, a real need to get people vaccinated. Listen, the vaccines work, and we'll be able to show that to you. And really, it almost eliminated sickness in the months after. And even 5-6 months after had made it almost rare to get sick out of COVID for having it. But the longer it goes, the more we are seeing vaccinated individuals having tougher outcomes. So with all of the new information that have come in, our hospitals being able to breathe, there's been a pretty big update in vaccination status of cases, hospitalizations, and deaths. If we boost, if everybody who's gotten a vaccine goes out there and gets a booster, this chart will look like it did 2 months ago as opposed to where it does now. So as you can see, this has been a pretty significant change. Now 16% of all cases since March 1 are of fully vaccinated Kentuckians. And the hospitalization, remember, this has changed now from 92%, where it was for a long time. 92% of all hospitalizations were unvaccinated, now down to 84. You could flip it the other way around and say the hospitalizations for fully vaccinated have gone from 8 to 15.8 out of that group. Again, this isn't bad news. The vaccines work. It's just you need a booster for the vaccines to continue to work at the level that we need them to. Deaths, again, our statistics have been about this for a little while. But again, it is critical that everybody get out there and get that booster, because every month that's going by, we are seeing more vaccinated people by percentage of overall cases and hospitalizations increase. All the data, though, that's what they saw in Israel. That's a little bit of what they saw with older individuals in the United Kingdom. And once they did nationwide boosters, which they did, the numbers went back in the direction that they looked right after the initial vaccinations. So if you qualify for a booster, and 80 to 90% of us do, again, I'm gonna get mine on Thursday right here. Go out and get your booster. Schedule it as soon as you can. And remember, everybody 65 and up can get a booster, should get a booster. You can get any type of booster. If you took J&J for your first shot, go out and get a booster right now. Right now. If you got J&J, get it and get it as fast as you can. Otherwise, if you have any major underlying health condition, go get a booster. You qualify. And finally, if you got a job where you interact with a lot of people, go get a booster. Folks, that is most of us. That is the vast majority of us. So my message to you is go get a booster. It's going to help us defeat this thing. It's going to help us to get back to a real normal. And I think we also see on the next chart, which we've shown you before, rate of COVID-19 cases and vaccinations, that with the wane of immunity that happens slowly over time, the vaccinated versus unvaccinated has gone really at one time. This was 6 or 7 times higher for unvaccinated than vaccinated, down to about 3.7. We can stretch that out to where we were back in June, July, May. And of course, that also tamps down overall cases. All right, let me make one other pitch for getting vaccinated, especially if you're in that 30 to 49 age group. And that's because a whole lot more people in that age group are now dying. And in that age group, almost entirely unvaccinated. We have shown you these pie charts before. And hold up for a minute, Scotty, where one of the great things to see was those over 70, were 75% of the first one. And then it cut it down in half. And what we saw is 50 to 69-year-olds increase. But I want you to compare when this comes up, 30 to 49-year-olds pre-Delta and where we are now. It is dramatic. When you look at deaths before the Delta variant, only 2% of all deaths were in the age group of 30 to 49. That is now 13%. That is a 6.5-fold increase. So if you're in that age group, and I am, a lot of people in our age group are now dying of COVID when nobody did before. You need to get your vaccine. And then if you qualify, you need to get your booster. All right, let's look at the current state of vaccinations. Let's get to the adjusted overall numbers. We're going to look at this demographically today. We're still working all the counties were impacted. This is our new number as of today of individual Kentuckians that have been vaccinated. And hold right there for a second, Scotty. 2,556,655. That is with all of the duplicates removed because we wanted an accurate number along with the vaccinations that we have done over the last several days. So go to the first one. What that means is 57%, we've been over 60, but 57% of all Kentuckians. And this includes people who are not eligible. So 57% of all Kentuckians have had at least their first dose. Next number, again, we'd had up higher, but 67%, over 2/3 of everybody eligible in Kentucky for a vaccine has gotten at least their first dose. We need to push this more, but 2/3 of eligible Kentuckians isn't bad. We just know we have to do better. And then when you look at 18 and up, and the reason we show this is that's when it's your choice, right? On your health care, almost 70% of all Kentuckians that age have gotten at least their first shot of hope. We got to do better, but I am proud of that for something so new that's been so politicized, that there is so much out there on Facebook and the rest. Almost 70% of Kentuckians that can make their own call have gone out there and gotten this shot. But what that means is at 70%, we really need you to continue to talk to your friends and family and relatives that are in the 30%. Try to do it with kindness. You may be the only person that can get through to them, but that's, again, where we have to go. So those are the updated there. Now, let's look through the age demographics. 75 and up didn't change a ton. 88% with at least their first shot of hope. That means we got 12%, the most vulnerable population out there that we've got to reach and ultimately get vaccinated. 65 to 74, these are our winners in the clubhouse. 92% of everybody in that age group having gotten vaccinated. By the way, if you know somebody in the 75 age range and it's a transportation issue, we can now send people in most places to them. So please reach out. All right, next two need to do better, but still 50 to 64, 75% of all Kentuckians. That's 3/4. Again, this age group, the share of deaths increased pretty significantly with the Delta variant. Need to get vaccinated. 40 to 49, 2/3. Again, we would have thought that this was a phenomenal accomplishment, but for how quickly this thing spreads and the number of people that it takes. 25 to 39, 56%. 18 to 24, 48%. 16 to 17, 46%. And then 12 to 15, 42%. So certainly 12 to 40, almost half of Kentuckians in that age range have not been vaccinated. And that's where we've got to continue to work. All right, so a very full update today. We got 3 journalists here with us. We have 5 with us virtually, and we'll start with Chad.
Governor, I noticed you talked today to educators, and we've done some stories in the last week of several more districts announcing that they are starting to lift their mask requirements. I know that's something that you're encouraging them not to do. Can you talk to me a little bit about that message now that we're seeing those numbers go up? It
is too early to lift universal maskings at our schools. This is the least this is the least vaccinated group in Kentucky. Can you put the last chart up, Scotty? First of all, there are entire classrooms of fully unvaccinated individuals because they're not old enough. My daughter is one of those. That means you're taking 20, I hope it's 20 in a smaller classroom, unvaccinated individuals, unmasked, around each other in a poorly ventilated room for what, 6, 7, 8 hours a day? That not only is where COVID wants to thrive, but it puts everybody that works in those buildings at risk because of their extra exposure. So they ought to get a booster. That's not the answer, but I really want those individuals to go out and to get a booster. And even as we go up, half of every classroom at an older age would be unvaccinated. We want to beat this thing. and it is moving in the right direction. And then we make a decision that gives COVID the tactical advantage. Right now we're doing just a few things that we know help us win, and numbers are going down. But it's like getting, 3/4 of the way up the field and you stop playing, or you're playing into the first part of the second half and you stop playing. The virus is still very much here, and until these numbers are better, I think we need to continue that universal masking. Now, I have a hope that this school year that we can even provide the recommendation that the kids no longer need to mask, but it's not yet. It's not now. We ought to stick with this, especially in schools, for at least another month and see where we are. Tom.
Governor, today we've reached roughly over 5 million people who've died of COVID worldwide, and about 750,000 here in the U.S. Is there any sentiment for any more actions that can be taken to tamp this thing down?
Well, we've lost
vaccinations.
Yeah, we've lost far too many people across this globe. As you said, 5 million. We're going to very soon reach 10,000 Kentuckians that we've lost. Prior to this, unimaginable. We all know 2, 3, 5 people who've been lost to this, which outside of other circumstances, I'm not sure a generation has lived through in 100 years this amount of loss. And I believe because we're in it, we're not processing the grief, communal grief and individual grief that is going to linger with us for a while. I think that in many ways and in many places we are taking the right steps, but it is a reminder, the amount of people that we've lost, that it's not over. And if we get lax, we lose more. I mean, the most tragic loss in the course of this pandemic is the one we could prevent. In the beginning, especially when New York got hit, knowing very little about this, a lot of those deaths were unavoidable, but now they're almost entirely avoidable. So, if a school drops that mask policy and it spreads throughout the school and then people go home to their grandparents, right? That is an avoidable loss that we know how to prevent. So, my hope is that we keep it up, but a lot of where we are now, at least based on the special session, is we need people to make the right decisions. Mike.
In anticipation of the CDC's expected final stamp of approval on that vaccine, 11 years old, have you received any guidance from the White House on how those vaccines will be distributed?
Yes. So in anticipation, including mine, of 5 to 11-year-olds being approved for vaccinations, we believe on day 1 that those can start. We'll have enough in this state to vaccinate a third of that entire population, right, on day 1. Within the first couple weeks, we will have enough to vaccinate half of that full population. And we think that will probably outstrip demand in the first couple of weeks. We've seen with these age groups, sometimes parents want to learn a little bit more. They're primarily going to be at the places that vaccines are already are at for adults, which is a little different than how kids often get vaccines. But you really want to look at your pharmacies and your grocery stores and the place that you, as an individual, got your vaccine to sign your child up for one. The moment they do it, I'm signing my daughter up because it is safe. And it's going to help us defeat this virus. Remember, it is packaged differently. It is not the same vaccine that adults are getting. Its packaging is orange as opposed to purple, and it is a lot less. And you can't simply put less in the syringe of the adult version. The kids version is manufactured and shipped specifically for those kids. So here it is. We are ready. As soon as any set of parents are ready. All right, Corinne Boyer, WEKU.
Hi, Governor. Will the booster shots be included in the state's dashboard? And if they're not, then how useful will vaccination numbers be if boosters aren't included as immunity wanes from those original vaccines?
Right. So even if somebody doesn't get their booster, obviously they're much better protected against COVID than if they'd never gotten vaccinated. So we still will be sticking with the how many unique Kentuckians have a level of immunity through vaccination. That's the what we track right now, which is the one shot. Now the CDC tracks percentages with 2 shots, and then Eric, have they put something up on the booster yet? Yeah, we think that the federal government will be tracking that. You can get on the CDC dashboard right now and see Kentuckians with the second shot and then the third. We'll look at what to add on our dashboard. We know that the CDC tool is out there that people go to, but we keep trying to. What is in many ways the simplest way to say this is the number of Kentuckians who've made the choice to protect themselves and those around them. Karen Czar, WUKY.
Thank you, Governor, and thank you, Virginia. I have 2 questions. The first
Virginia.
is, will this, oh, hello, Virginia.
Yeah, I can't see her, but hello, Virginia.
Will the best way for parents and guardians, once it is approved for the 5 to 11-year-olds, will the best way for them to find a site still be the state website? And then the other question is, with the new data that you presented today, would you like to see booster restrictions and requirements completely eliminated at this point? Thank you.
So I would like, yes. I think everybody should be able to get a booster. I think everybody should be able to get a booster 6 months after they got their last shot. Let's make sure the largest number of Americans and individuals throughout the world that can be back at that 90+%, they'd be less likely to catch it and be less likely to spread it. We have seen how almost normal our country can be right after vaccinations. And this helps us get back there. It even protects, I think, or better protects those that have not gotten vaccinated. What was it? Oh, the booster shot is up on the CDC website. What was the first part of the question that I missed? Oh, vaccination for kids. Yes, go on the state website. It directs you to the federal search tool, which will have a spot. They've already developed it. They haven't made it live for kids. Just like you have to look specifically on there for your 12 to 15-year-olds, like we did. It's the same tool, same way people are getting online right now. Melissa Patrick.
Hi, Governor. Can you give us an update on the availability of monoclonal antibody treatments in Kentucky, and has there been enough to meet demand?
Yes, there has been enough to meet demand because demand has dropped. We got really fortunate when demand was surging that the federal government departed at least a little from each state's going to get X amount and really looked at where the need was the greatest. So we got more than the suggested allocation when times were tough. And now the demand has really plunged significantly. And so we are still supplying the sites that we put up that are on the website, but certainly meeting demand. Now, there are 2 types of monoclonal antibody treatment, and some people come in wanting one specific type and done in one specific way. I mean, there's both the infusion and there are shots. Now, what we can't guarantee is that everybody gets the brand that they want in the way that they want it. But yes, from every indication we have right now, there is sufficient monoclonal antibody treatment out there. That's really good news. Sarah Ladd from the Courier-Journal.
Yeah, thank you. Regarding that increase in cases and the small positivity rate bump, I know you said it's a little early to know what caused it, but just curious if there's any indication if, it's more waning immunity. Is Delta going to surge again? Is it another variant? Any indication on what exactly might cause it?
Yeah, so the sample size is the smallest possible in our data. And so I just pointed out because I haven't seen it. at least the cases in a while, and we've only seen 1 or 2 examples on the positivity rate. Again, just this is trying to be humble on what this virus can do, since at different times it's been unpredictable. Actually, that's its goal, right? To be unpredictable, to outsmart all the defenses that we put up. So I think it's too early. If it's more than just a daily blip, which it could be, then the question is, are we moving towards a plateau as opposed to a significant downward slope? We start getting more parabolic, which is possible. When we look in the past at when we have come down, eventually we have hit not a zero, but kind of that new plateau. Again, we've had so many days of decreases. I'd be surprised if all of a sudden, thud, we're at that what the new floor is. But I just think it's worth pointing out anytime we see these, so that we are careful. Waning immunity. When we look back, I think we'll have more cases and the Delta variant, and it's 2 things, right? It's the aggressiveness of the Delta variant and that immunity piece. I think that we'll see, again, when hospitals are able to upload all the data, that the case for boosters is even stronger than we previously believed. Rachel Droz, WHAS 11, with our final question. All right, then Sarah Ladd, congratulations. You had our final question. Thank you, everybody. A lot of good news out there, and really even on the COVID front, while we still continue to lose people, it is good news in the continued decline. Let's just be humble. Let's just be careful. Let's watch this really close. Let's continue to protect one another. Again, we don't get to choose how long we're battling this thing, but what we do get to choose is how we do it and how we protect one another. Thanks for joining us. I wish I could for all your continued efforts to make sure that actually had today a visit with ambassador to the United States, and one of the messages were made to translate these, get information directly to people in their difference. I think Virginia was a pioneer there, making sure could get the information. That story is those were Kentuckians volunteering to do it, coming to us, looking out after so many folks. So let's keep it up. Thank y'all.